Hello and welcome to Level 4 Health and Social Care, Unit 403, Intro to Healthcare Policy. And we're now looking at Part 2, which is focusing on the policies of the Labour government 1997 to 2010. And the objective we're addressing is Objective 1.1, where you need to summarise the main healthcare policy reforms introduced by the Labour government from 1997 to 2010. Okay, first we look at some of the goals and the policy aims and the policies of that Labour government. And there were two high-level goals that were in the Labour Party manifesto at that time. And the first one is saving the NHS through a programme of healthcare investment, modernisation and reform. And the second one was improving overall population health outcomes and reducing health inequalities. And England, the programme of healthcare modernisation really started by creating targets and performance management so that they could identify these outcomes when they were achieved. Because previously to this, there was no way to really evidence overall across the country what outcomes were and what achievements had been made. Also with health inequalities, they needed some baseline data as well to identify what the health inequalities were so they could measure themselves against them later on. Added to this, another thing they wanted to introduce was a plurality of providers. So to expand capacity and drive up quality, they wanted to bring in other providers, not just the traditional NHS hospital GP-based providers, but allowing people to bring in private organisations who supposedly had skills in that area and could actually compete with those of the NHS. And they felt that that would actually drive up quality and give some competition, but also give the patients some choice. Another attempt was to decentralise some of the organisational structure, less at the sort of top government level, and bring that sort of down so that they would create primary care trust, which were focused on local areas. So the primary care trusts were focused on sort of commissioning the care, like the GP care, community nurse care, all the stuff that happens in the community, midwives, district nurses, but on a local basis, and separately from the hospital as well. Okay. There was also bottom-up pressure to drive up standards, and that's sort of by, trying to learn from complaints, involving people in consultations, more inspection and strengthening of regulations that were inspected, so strengthening the regulating bodies as well. In their first term, 1997 to 2001, they had just taken over from the Conservatives, and it was a key part of their general election campaign, which probably helped them win the election, was that the concern about the NHS, and saying, one of their straplines was that those who voted had 24 hours to save the NHS, really. So it was very much the Labour Party saying the attitudes of the Conservative and the fact, who were still using the Thatcherite policies, were damaging the NHS. And if you cared for the NHS, vote for us, really. However, they had immediate plans for lots of cash injections into the NHS, but that was actually delayed for quite a few years. And they just committed themselves to upholding the Conservative expenditure plans and not raise taxes, because there was an issue at the time about raising taxes. And then they started, they considered the plans for alternative financing models, which the Tories had done but backed away from. And again, they backed away from this as well. This has been an issue which governments have been backing away for a long time, because most people, are happy for it to come out of their national insurance, but then they don't want to spend any more taxation on it. The Healthcare Modernisation and Reform Programme has taken hold, and this is really about creating the regulators, so bumping up the inspection role. Originally, inspection had been done by each local authority individual. Creating CQC, who are a national overarching organisation with set standards. The idea was that everybody would be inspected and regulated on a more formal, more organised, and more standardised approach. So one care home who gets in the north of England and another care home in the south of England will be inspected in the same way. They also introduced NICE, the National Institute for Clinical Excellence, as another organisation that sets standards, does research, creates information, gives guidance, all to support the staff who perform. National frameworks as well, national framework for obesity, national framework for pulmonary diseases. So they had these frameworks again, so that people will be treated and their condition managed in a standard way across the country. NHS Direct they set up, which is basically the telephone advice system. And then they introduced some targets for reduction in waiting lists, targets for performance, and they introduced the overall NHS plan, which is just an overarching plan looking at how the whole system needed to be managed. They introduced some organisational reforms, and they kept the purchaser provider split and the PFIs that were mentioned before, private finance initiatives. The public health measures included, there was an Aitchison inquiry into health equality. So the inquiry gave them a baseline to work from. And they bumped up the Food Standards Agency, and again made that a national organisation with set standards. This was for, restaurants and cafes and retailers, various things like that. They also had some multi-dimensional strategies, such as health action zones, which were very focused in particular areas. So if there was an area that had a particular problem, might be related to the sort of work that goes in there, like a polluted area where there's a lot of chronic obstructive airways disease, there would be a local health action zone about that, where they would focus on getting into the nitty-gritty of that. And they also introduced Sure Start centres, which is basically probably one of the most popular of their policies, which was support for people with young children. Any difficulties, any disabilities, it was all sort of managed and organised from there, including childcare and child assessments for any disabilities or falling behind. The Sure Start centres were a massive area of advice to people with sort of young, particularly preschool children. In their second term, they decided to develop the world-class public services agenda, which is again about raising standards and introducing public service agreements in localities. And they're very much focused on world-class. That was probably the first time that statement had been heard, trying to sort of be a lead in your area. Lots of outcomes targets and overall health outcomes and inequalities targets. The Wanless review looked at resources, what was needed, and following that there was an unprecedented funding increase, huge amount of funding given in, and they called it the catching up and keeping up agenda. So they put enough money in, not just to sort of everyone get up to scratch, but enough money in sort of fit for the future, really. and there were quite strong financial increases over the next few years annually. There was still more emphasis on competition and choice. Different providers essentially supposedly enabling service users to choose. So, I'll go to that hospital, go to that hospital, or I'll go to that clinic and do it. Although, in my memory, that wasn't always offered, even though supposedly it existed. This is linked to the creation of commissioning bodies such as the primary care trusts. The primary care trust, as I said, was sort of a local group that was set up to commission just all the local primary care services. And really, it's, supposedly you're supposed to have lots of choice. Although officially you could go along and say, what about this provider? They're more than likely go, oh, sorry, we haven't got a contract with them. So it was a bit hit and miss, really. Public health measures, including the launch of a cross-department health inequality strategy and a white paper, which is the first one of its kind, signalling the government's intention to introduce a smoking ban. In the third term, we are looking at 2005 to 2010 is their last term in office. The rate of increase in healthcare expenditure eased off, really, because there had been several years of sustained increases. However, public spending did continue to grow, just by about 6% in the final year. So they were still meeting real-term requirements, but maybe they weren't pumping a huge amount that they'd put in earlier, which when they were trying to get things up to standard. The pace of organisational change and reform slowed, because I guess towards that time they're starting to worry about another election as well. Although waiting time targets, they were tightened up, and then they were often being met. There were further inquiries just to look at how reforms had gone and whether health equalities were yet being met, and that produced further recommendations. The smoking ban actually went through and was introduced, the smoking ban in public places, which was put down into legislation and remains to this day. And then there was also a new cancer strategy, health equalities intervention, and NHS had a new constitution, so that people were involved in, so that people could sort of say they'd been involved in setting a new constitution. That didn't change a lot, really, but it was more about who was responsible for what. Measures were taken to improve accountability, and there was local area agreements, which particularly were led by local authorities, the councils, and they were taking a bit more responsibility for public health as well, taking a bit of the load off the NHS. In the devolved countries, Scotland, Wales and Northern Ireland, there was more changes in healthcare policy as the Labour Party devolved more responsibility to them, so it gave them responsibility to make decisions in their own country. This is the first time, really, and since then it's picked up, and they have, in fact, they pretty much have sole responsibility for health apart from public health. Prescription charges were maintained in England, but abolished in Wales, and they went on to abolish them in Scotland. The ban on smoking in public places was implemented in Scotland and Wales ahead of England, because the legislation was somehow quicker to get through their parliaments than they were to get through the English one. But they basically all did it in the end. So the smoking in public places is across the UK now. Resources. Health expenditure was a national priority under Labour, and it was identified as one, and they weren't ashamed about spending money on the NHS. There was quite significant growth in public expenditure across all terms, It was well above the rates under the previous Conservative governments. So quite a substantial increase of the national resources was devoted to healthcare. Our international position, the gap with the European average, measured by expenditure to real expenditure to gross domestic product, was virtually eliminated. So basically, we were spending on average the same as other countries with the same gross domestic product as us, when we were spending less before. The financing model, it remained as general taxation, part of the national insurance funding, and there was no real change. There was always ideas thrown around, but again, I think, as I mentioned before, most political parties have shied away from doing anything different because, you know, it's going to be a vote loser. So it's going to be quite difficult. Outcomes. There were quite substantial overall improvements in healthcare access. So breaking it down into sort of 4 areas: access to healthcare. Waiting lists were improved dramatically. Waiting times were shortened dramatically, and the number of GPs per head increased a lot. So there was more GPs in the community dealing with things. So reducing the amount of people going to hospital, reducing people having to wait, you know, nipping things in the bud earlier before they got more complex. However, there was still inequalities in deprived areas. So basically, you know, the wealthier areas have more GPs in them than the deprived area. So it's not completely eliminated. There was a reduction, but it's something that sort of remains really to this day, and it's sort of down to the fact that GPs are independent contractors. They don't work for the NHS, so they don't go where they're told in that sense. So they only set up a practice in a town they want to set up a practice in. So they don't necessarily want to work in deprived areas, and those that do, you know, tend to take on a bigger load. Healthcare quality. There are definite improvements in healthcare quality, particularly in the statistics of post-operative survival rates and reductions in avoidable mortality. So that's through people being treated in hospital, really, properly. So the quality of the service had gone up. Patient experience and individual satisfaction. Patient experience, service user satisfaction with the NHS rose from lows of 36% in 1997 to high, and this is the highest probably it's ever been, of 71 in 2010. Variations in hospital performance. They were still concerned that some hospitals were still performing better than others, even though they were trying to do these sort of cross the board things. So they were being picked up and being highlighted, and they were probably the biggest concern at the end of their period in power, that they hadn't managed to standardise the care. Now, some would say it was because they had these private professional, you know, a variety of different providers. So one area might have better quality providers than another area. So they're not all meeting standards, or just some are just better. Some more outcomes, some large statistics. Life expectancy, overall life expectancy improved gradually over their period of time in power. So overall life expectancy was better. Infant mortality reached historic lows in all 4 countries in the UK by the end of their time. Circulatory mortality, so those people suffering from pulmonary or heart disease, there was a major achievement there. They had a 52% reduction in the average of circulatory disease for men under 75. and they met all their targets for overall circulatory mortality. So this was really good. Well, there is there is a thought that the smoking ban probably had something to do with the massive increase in the under 75s, reducing heart and lung disease, probably. Cancer mortality, the overall cancer mortality also fell during the period, 22% fall over both periods, really, and some important reductions for some specific cancers. And yes, it's lung cancer, so we know where we can connect that to as well. But to be honest, it had been effective, and they met all their targets to reduce cancer mortality. There's still work to do, but they met all the targets that they'd set. Suicide, they did have a target for suicide. There was a reduction in the early years, but unfortunately, from 2008, in the last couple of years, the rate increased for males over 15, and this was in line with other European countries, because the whole of Europe was in a financial crisis and an economic downturn at that time due to sort of banking failures and that. So there was a general consideration that the financial situation had affected the suicide rate. Inequalities. It had been difficult for them. Although there were some good news stories, they knew there was a lot more work to do, really. Life expectancy in areas with different class backgrounds, although the gap had reduced, for both men and women, the relative gaps increased. So the life expectancy for the wealthier areas actually got better and better. And although it got better for the poorer areas, that the others were streaking on ahead. Infant mortality was quite slow, but it increased over the years. Circulatory mortality was quite good. However, the gap with the most deprived areas was increased. So although mortality went up for everybody, went down for everybody, the gap between the sort of richer and the poorer again increased. It got larger. And the same with cancer mortality, although they reduced more. Thinking about behavioural and lifestyle issues, obesity continued its tendency to increase. They didn't meet the target to reduce child obesity. However, there was a bit of evidence that it was slowing down at the end of their time, but they didn't really. Obesity was one that was not met. So they knew it was something that had to be focused on in the future. Teenage pregnancy, that the under 18 rate fell quite substantially. However, they were aiming for a 50% reduction, so they didn't meet it, but it had fallen in that sense. Smoking, the target was definitely met, and the further target was achieved to, again, looking at different backgrounds. They were particularly concerned about people in the manual occupation group, sort of working class, I suppose, and they sort of knew that the target was going to be easier to meet with the middle class. So unfortunately, the smoking prevalence about individuals from manual groups actually went up, although there was an overall reduction. So they knew that they had to, whoever took up after 2010 would have to make a real effort on that. So to conclude, Um, there was an extra 3% of GDP across the board, gross domestic product, were given to the NHS, and the gains were quite considerable, considering that isn't a huge amount of overall money. In 1997, people were very, very dissatisfied with the NHS. Waiting lists were terribly long. They were pushing people into private medical insurance because otherwise you'd be waiting forever for things. But by the end of Labour's period, the waiting lists were down, the demand for private medical insurance was down, and satisfaction was running at over 70%, which is the highest it's ever been. There were variations in quality and performance, and that was one of the things they were concerned about. And there's a little bit, there's ongoing debates about productivity growth and, you know, were they spending the money well? And although they said that, you know, so many health outcomes had mainly improved, they were still aware that these health equalities by class and region, you know, the deprived areas to the wealthy areas, they were there and they still remained, which was they found a bit disappointing. So there was some progress, although the lifestyle bit, there was less progress in lifestyle than there was in some of the medical issues. So we still remain sort of fairly low to our other comparator countries, which you know people are disappointed about. But I don't think the general population really looked at that in a lot of detail, to be completely honest, because the satisfaction rate wouldn't have been so high. So I think most of the population focused on their own, you know, what was good for them and their family. Okay, so I've put some references there for you, and there is some reading in extra reading. So please have a good look at that, and make yourself some notes for your assignment. Okay, thank you, and I will see you in part 3.